Welcome back. In this session, we are going to discuss another homeopathic remedy called Mezereum. The common name of Mezereum is Daphne Mezereum. You can see the picture here, the Daphne Mezereum. It was introduced into Materia Medica by Dr. Staff. Whereas the extensive proving was done further by Dr. Hahnemann. This medicine still remains as one of the Hahnemann's precious medical legacies, remarks Dr. Taylor in her drug picture. Dr. Taylor remarks in her drug picture that Mezereum still remains as one of the medical legacies of Hahnemann. Hughes tells us that Mezereum was one of the vegetable substances with which it was attempted to replace mercury in the treatment of syphilis. So we see that Mezereum has the capacity to replace mercury in the treatment of syphilis. Such enriched properties in cases of syphilis is found in Mezereum. So it has the capacity to cure syphilis. It is used in the treatment of syphilis, replacing mercury. An attempt was made to do so. This fact was supported by proving. Hence, the drug is also known as vegetable mercury. It belongs to the family Thymelaceae. Remember the point? If in your Viva voice, if they ask you, which is the vegetable mercury? The vegetable mercury is Mezereum. It was an attempt was made to replace the mercury in the treatment of syphilis by Mezereum. Hence, it is known as vegetable mercury. Moving further to the sphere of action and the pathogenesis of Mezereum. Mezereum acts on the skin. Acting on the skin, it produces variety of destructive changes. You can see the destructive changes starting from the simple non-eruptive itch to the most malignant ulcers. So, acting on the skin, it produces mild eruptions, non-eruptive itch, non-eruptive itch, okay? It produces non-eruptive itch to the most malignant ulcer. Acting on the skin, it produces non-eruptive itch to the malignant ulcer. Such varied is the action of Mezereum on the skin. It produces lesions with or without oozing. If there is oozing, the black discharges will dry up and they become thick leather-like. So we see here, if at all the oozing is present, they dry up and they form a thick black-like scab, okay, leather-like scab. They form a thick black leather-like scab. So this is the scab and this is our skin. So, within the scab, the material intervening between the scab and the skin is a pus-like soft pus. You can see the soft pus will intervene between a soft pus is going to intervene between the scab and the skin. Okay? You can read here, what are they saying? The lesions could be with or without oozing. There is black discharge. Okay, we saw the black discharge. Then the black discharge got dried up and it formed a thick leather-like scab. Clear? And now there is a soft pus-like material which is intervening between the scab and the skin surface. Clear, guys? Let me just draw it again here. So this is the scab, okay? And between the scab and the skin surface, we have a thick pus-like, yellow pus-like material. Okay? There is a soft pus-like material. Acting on the bones, what does it do? Mezereum acts on the bones. It produces inflammation and bone pain, which is nothing but the osteomyelitis. Particularly, it acts on the periosteum of the bone, producing inflammation and swellings and the bone pain, severe bone pains. Next, the mesereum acts on the nerves. Acting on the nerves, the action of this drug is to produce neuralgia. It produces neuralgia predominantly about the teeth and the face. You can see the neuralgia is predominantly of the face and also of the teeth. Neuralgia of the face and teeth. So this is the sphere of action. What did we see? Acting on the skin, it produces non-eruptive itch to the malignant ulcers. It will form the discharges ooze out, black eschar they'll form, and the scab will be leather-like, and between that scab and the skin there is a soft pus-like material. Then acting on the bones, it acts on the periosteum of the bone. It produces inflammation and bone pain. Neuralgia nerve predominantly affects the teeth and the face. Moving further to the constitution, the physical makeup of the patient. It is suited to light-haired, irresolute people. So we see mesereum is suited to light-haired person and irresolute. So what do you mean by irresolute? Irresolute are those people who are uncertain how to act or how they have to proceed. They are very uncertain about things. An example here is given. The irresolute lady don't know what to say when the man asks her to marry him. So when the man asks her to marry him, this lady who is irresolute does not know what to answer, whether or not she has to accept the proposal or reject it. She is irresolute. Also, we have another example here. There being still no answer, I went out at the door, irresolute what to do. So the person was very sure. He was like, okay, I'm not going to go to the party. But then again, he went out to the door, approaching the door, planning to go out, but still not knowing what to do, whether to go attend or not to attend. Irresolute don't know what to do, cannot decide on one thing. They are very irresolute people. They are unable how to act. There will be inability to proceed and act. Moving further to the temperament. Mezereum is suited to phlegmatic temperament. Phlegmatic people are those who are quite introverted. They are easygoing people, agreeable. There's no lots of contradictions will not be present. They are agreeable, soft natured, a kind of peace you can see on their faces, the softness you can see on their faces, easily convincible people. So these are the phlegmatic temperament. So mesereum is belonging to the phlegmatic temperament. It has miasm, sora and syphilis in the background. So whenever we study the guiding symptoms and the particulars, you need to know which miasm is acting in the remedy, so that you can understand the modalities and the level of pathogenesis. So we see syphilis, that's the reason we have this malignant ulcers here, and in the bones there is inflammation which shows sora. So we have sora and syphilis in the background. Relation, that is how we have to relate it. Okay, relation with the heat and the cold, they are chilly patients. So we are understanding mesereum, how and where the mesereum acts and what it produces. So far we studied mesereum acts on the nerves, it produces neuralgia. Acting on the bones, osteomyelitis. Acting on the skin, it produces non-eruptive itch, that is like itch is sora, to the most malignant ulcers, that is syphilis. So far we are very clear. Now let us move further to the guiding symptoms of the mesereum, which will guide us, or the keynote points which will guide us to the selection of mesereum. Bad effects of vaccination. So the first symptom which is guiding towards mesereum is it is indicated in the bad effects of vaccination. The other remedies we can think of is antimtat, silesia, thuja, crotalus horridus. We also have a nosode called melandrinum, which is very good in bad effects of vaccination. It is a nosode prepared from the grease of the horses. So it is especially the skin eruptions. Here the bad effects of vaccination. The bad effect could be in the various forms. It could result in either gastroenteritis, or it could be malnutrition, hair loss. So we had this COVID and the post-COVID vaccines, people faced a lot of hair loss. So that was quite a sensation at that time. So now we see here the bad effects of vaccination in mesereum is skin eruptions. Okay, the bad effect of vaccination is the skin eruptions. You can see in the picture here, post vaccination this patient has skin eruptions. Okay, its action is characterized throughout by violence. So we see Mezereum is very violent in action. They have very violent pains, violent itching. So if a patient comes up with the violence in their presentations, if the clinical presentation is very violent, the pains are violent and there is violent itching, if the symptomatology matches, we can think of Mezereum. Okay, there is violence. So what did we see? The guiding symptoms, bad effects of vaccination and violence. Okay, these two are clear. Moving further, the patient is very much sensitive to cold air. So we know what were the thermals relation to heat and cold, they were chilly. So if they are chilly patients, they will be very much sensitive to cold air, and the pains of the various kind are associated with chilliness. So guys, in Mezereum, when we study the particulars, we will see that headache has a tearing pain, boring pain, and in the toothache also there will be neuralgic pains. All of these pains are associated with chilliness. Okay, the various kinds of pains are followed with chilliness. They are chilly remedy. Patients thermally are chilly, so they are sensitive to cold air, and all the types of pains like a pricking pain, boring pain, neuralgic pains, all types of violent pain, they are followed by chilliness. Ulcers with a thick whitish yellow scab. You can see in the picture here, very beautifully given. You can remember this like this guiding symptom of Mezereum forever with this picture. We see the guiding symptom is that they have ulcers with a thick whitish yellow scab. You can see it is thick, it is whitish yellow scab. You can see the scab here, the scab which is thick and which is whitish yellow. Okay, it is whitish yellow, thick whitish yellow scab, along with the thick yellow pus which is collecting underneath. You can see beautifully given, the thick yellow pus is collected underneath the scab. This is the scab, whitish yellow scab, whitish yellow scab, and then we have the thick pus which is collected underneath the scab. You can see the pus collection. Okay, this is the very characteristic symptom. This is how the skin ulcers will be presenting with. The ulcers have a thick whitish yellow scab under which the thick yellow pus collects. Moving further, the head is particularly covered with a thick leather-like crust. You can see in the picture here that the head, the scalp will be covered with a crust. This crust is going to be leather-like. It's thick leather-like crust. The head is covered with a thick leather-like crust. In the picture, you can see the thick leather-like crust, and seeing the picture, we can tell that there is neuralgia, especially the facial neuralgia. Toothache will be seen, and the toothache will be aggravated by eating. You can see here the facial neuralgia is after zona. Okay, after the zona is nothing but the eruptive diseases. The facial neuralgia is seen after zona, and we have toothache. The toothache, the pains are aggravated by eating. Eating is aggravating the pains. Okay, in Mezereum, the toothache is aggravated by eating. It is a neuralgic type of pain. Facial neuralgia, you can see the toothache here. The nerve affection, toothache. Yeah, the nerve affection and the toothache here, it is aggravated by eating. Okay, and we also have facial neuralgias. Moving further, aggravation at night is a generality of Mezereum. So we see Mezereums, we also have the predominant miasm syphilis in Mezereum. So what are the complaints, aggravation, the modalities of syphilis? The complaints always in syphilis are aggravated at night. So they are known as sun worshippers. As soon as the sun rises, the complaints come down in syphilis. So they worship, the sun worshippers is prominently known as the syphilis people belonging to the syphilitic miasm are known as sun worshippers. And here we see that at night the complaints are aggravating. Moving further to the mental symptoms of Mezereum. Mentally, the patient is hypochondriacal. So we see here hypochondriacs are those who exaggerate their mild illness. She just has an headache. So this she has an headache. So she thinks of hepatitis. She thinks of kidney disease, allergy. If she's seriously ill or she has some cancer, inflammation, brain tumor. So they exaggerate their symptoms. Okay, they think it in a very serious matter. So we see that the patient is hypochondriacal. They are sad, despondent, indifferent to everything and everyone. So we see the indifference in Mezereum. So we see the other remedies which have indifference. So we can think of sepia here. So the other remedy is sepia, which we always think in cases of indifference. Now in Mezereum also we see the indifference. So what is the Mezereum having indifference? Indifference in Mezereum is for the pleasurable things or the surrounding pleasurable surroundings or the people or the company with which he is with. Everything seems dead to him in the company. If the Mezereum patient is in a company, if there are some like five friends, okay, a group of five friends. Now if the patient is a Mezereum patient, so he'll be so indifferent to what is happening in the group. If these two are fighting, he is not bothered, he's completely indifferent. So one of his friend fell down, broke his arm, indifferent, no sympathy, nothing. He is indifferent. He is dead to all the members in the like company. Everything seems dead to him, least bothered about what is happening, so indifferent even to the pleasurable surroundings, the people in the company who he is with. And we also see the anxiety when the patient is alone is felt in the stomach. Okay, the patient also has anxiety, and this anxiety is felt in the stomach. Okay, the patient becomes easily angry at the small trifles. So the silly matters make him very angry. And at perfectly harmless things or words, he becomes angry. But as soon he is sorry for it. You can see in the picture here. Let us take an example of a husband and a wife. So it could be either way. The husband could get angry in the morning, and then once he's back from office, he could be angry because the wife did not iron the shirt, or she did not cook the food, did not pack his lunch. So something similar like that we can think of. And then the husband becomes so angry, even the harmless words will offend and make him very angry. But as soon as the patient the Mezereum, that husband comes back home, he's completely fine. He apologizes to his wife. And again, after some time, he again gets angry on her and again apologizes. So this cycle repeats in the Mezereum patient. They soon become angry at the trifle ailments, and again they become sorry for it. They are sorry for it. They again come back and apologize. Even the perfectly harmless things or the words, he becomes angry, but the patient is soon sorry for it. So you might get such patients in your clinic. They come and tell you, so this is how I am. It could be some working mother. She's like, I'm completely angry on my kids, and then again I'm sorry for it. Then they keep getting angry at the slightest thing, and later they are again sorry for it. Weak memory, absent mindedness, and aversion to talking. I told you they have indifference, they have great aversion to talking. Weak memory and absent mindedness is seen. The memory is weak and absent mindedness is seen in Mezereum. There is fear, apprehension, and faintness as if something would happen. So we see here in the patient that they have fear, apprehension, and faintness. There is also faintness. The patient feels as if something would happen. The faintness will be caused by shock or pain, or by hearing some bad news. Okay, by hearing a bad news or pain, or by a shock, the patient faints. Moving further to the ailments from anger, abuse of mercury, alcohol, anger, abuse of mercury, alcohol, and post vaccination. What do we have post vaccination, people? There is skin eruptions. Now we move on to the particulars of Mezereum. The very important thing are the particulars. The guiding symptoms will help us a lot in the particulars if everybody has focused so far, so you yourself can answer most of the things. So in the particulars, okay, I'll tell you the common points. First we'll see the headache. Let us begin with the headache. What is the causation? What are the ailments? The slight frustration, vexation, and the anger can result in headache. So, ailments from we saw just now: anger, frustration, vexation. So, the slightest vexation and anger can result in headache. What is the location of the headache? It is a right sided headache extending from the root of the nose to the forehead. You can see in the picture, beautifully given, that the headache extends from the root of the nose. It extends from the root of the nose to the forehead. Okay, it extends from the root of the nose. The headache is extending from the root of the nose. The headache extends into the forehead, nose to the forehead. Fine. Next, there is a sensation. The patient feels as if the head would be crushed. You can see in the picture what is the sensation of headache, as if the head would be crushed. The character of headache, while explaining the modalities, I told you that the headache is of violent type, boring type, tearing type of pain will be seen. Pain in the head will also cause the faintness. So you can see the violent type of headache, tearing pain, boring pain associated with chillness, followed by chillness, and the pain in the head is causing faintness. In the guiding symptoms, we saw all of this. Aggravation from the slightest touch, motion, and at night. The patient has aggravation from touch, motion, and at night there is aggravation. Amelioration is by open air, by heat, and covering the head. The patient feels better in open air, by heat, and covering the head. When the patient covers the head, and by heat, the patient feels better if he is covering the head. Okay, if the patient covers the head, he feels better. Covering, and heat, and open air amelioration. Moving further to the toothache. In caries of the teeth will decay suddenly, especially at the root. So again, the miasm, you can think of syphilis here. So in the syphilis, there is caries and necrosis of the teeth. So syphilis, there is caries, necrosis of the teeth. You can see in the picture here, there is necrosis of the teeth, especially the root of the teeth, there is decaying. Character of toothache, again violent neuralgic pain. So we saw when we studied the neuralgia, it causes facial neuralgia, and the nerve affections will be there. The toothache is neuralgic toothache, and the dull pain when the patient is biting on them. I told you, we saw the picture that when the patient bites the teeth, or while eating, bites on them, and when he is eating, the complaint is aggravated. Toothache aggravated by eating, Mezereum. The dull pain when the patient is biting on them, and when it is just touched by the tongue. Even the slightest touch by the tongue is also causing the violent neuralgic pain. There is scorbutic condition of the gum which bleeds. Also there is scorbutic conditions of the gums which is bleeding. There is decaying about the root of the tooth. There is scorbutic condition of the gums which bleeds. Aggravation at night and from touch. Just the touch by the tongue also aggravates the complaint. Amelioration when the patient keeps the mouth open or drawing the air in. Open air, and also by drawing the air in and keeping the mouth open. Okay. Now we move further to the skin. Skin complaints of Mezereum. Mezereum is an excellent remedy for skin affections, irrespective of whether if it is an eczema or itching eruptions after the vaccination, or it could be herpes zoster, or the ulcers of the various kind. We can think of Mezereum. So we can see here Mezereum. This is eczema. Mezereum is an excellent remedy in cases of eczema, and eczema after the vaccination, or itching eruptions after vaccination. It is used in herpes zoster and followed by the neuralgic pain in the herpes zoster, and ulcers of various kind. We saw the ulcers characteristic. There will be oozing black discharges, and they'll form a scab, and there is intervening between the scab and the skin. They have a collection of pus. And also we saw the ulcers. How were the ulcers? Thick whitish yellow scabs under which the yellow pus was collecting. Okay, they have ulcers of the various kinds. Eczema and itching eruptions are seen especially after vaccination. So you can see the eczema and the itch eruptions after the vaccination, with intolerable itching followed by copious serous exudations oozing out. I told you there will be violence in Mezereum. The itching is violent, the pain is very violent, and the copious serous exudate is oozing out in cases of eczema. The complaints are aggravated in bed and from the slightest touch. Moving further, the favorite site for many of the eruptions in eczema is the scalp. You can see the scalp is the favorite site of eruption. You can see in the picture here. The head will be covered with a thick leather-like crust. Again, in the scalp also there is a thick leather-like crust. We saw it in the guiding symptoms that there will be a thick leather-like crust. Particularly the head, that is the scalp, will have a thick leather-like crust. And here you can see under the scalp, the crust, there will be a thick and white pus which will be collecting. And the hair is glued and matted together. You can see the patient's hair, it will be all glued and matted together. The pus after a time will later become ichorous, then offensive, and it starts breeding the vermin. I have put a picture of vermin here. You can see after a while. Now let me just draw what happens. First, there will be crust formation. We saw there will be the formation of crust. Followed by the crust, there will be white pus collecting. After the crust formation, inside here and there, the pus gets collected. Following, there we have the ichorous, the pus turning to be ichorous. Acrid, okay, it becomes ichorous and it starts to burn. Okay, it starts burning like fire. It will be offensive, ichorous, offensive. Okay, let's do it like this. It is ichorous, then turns offensive and starts breeding this vermin in that area. Clear, guys? The crust will start collecting the pus. The pus turns ichorous and offensive and starts breeding the vermin. Ichorous becomes offensive, starts breeding the vermin, and we know it forms a crust under which the pus collects, the hair is matted to glued together, and the pus will be ichorous, offensive, and it starts breeding the vermin. The same thing is given here. The head is covered with a thick leather-like crust under which the thick and white pus is collecting. Hair is glued and matted together. Pus after a time becomes offensive, ichorous, and starts breeding vermin. Ulcers with a thick yellowish scab under which a thick yellow pus collects. We have studied this. The ulcers will have a thick yellow scab. We saw that picture wherein the ulcer had a thick yellow scab under which the pus collects here and there. Yellow pus collects. Now we see vesicles appearing around the ulcers which itch violently and burn like fire. So around the ulcer, the vesicles appear. Just you can see here, around the ulcers, the vesicles start appearing, and these vesicles will itch violently and they will burn violently like fire. They burn like fire, okay? They burn like fire. The linen or chappy sticks to the ulcers. They bleed when it is torn away. We know that they produce this offensive, sticky, yellowish, thick discharges, and these discharges will stick to the linen. And once the linen sticks to the ulcers, when you try to remove or tear away the linen, then the ulcer starts bleeding. Zona is followed by the neuralgic burning pain. So those skin eruptions are followed by the neuralgic pains. A general unhealthiness of the skin is found all over the body. The skin gets wrinkled, it turns in folds. So the skin, it is all wrinkled and it is turning in folds. The intense itching. The patient feels that thousands of small insects were creeping all over the body. The patient has a sensation, he'll come to your clinic, such patients will come to your clinic and they will tell you that they have a sensation as if thousands of worms were creeping all over their body. The skin gets wrinkled and they have this intense itching sensation of insects creeping all over the body, and reddish elevations appear on the parts where they have scratched. Okay, these reddish elevations will appear on the parts wherever they have scratched. You can see the reddish elevations will appear and they will burn like fire. The reddish elevations are observed on the parts where the patient scratches. And lastly, we have this liver spots on the chest. The liver spots on the chest and the arms, they become dark and desquamated. So guys, these liver spots are not because of some pathology in your liver. There is no problem. The liver is absolutely fine. These liver spots occur when you get excess exposure to the sunlight, UV rays or some radiations. Then we have this liver spots. Okay, liver spots are seen on the chest, on the arms. They become dark and desquamated. So in cases of liver spots, we can think of Mezereum. If the other symptoms match, then it could be a wonderful remedy. Modalities. The complaints are aggravated. The skin complaints are aggravated at night in the bed and from touch, from cold, damp and cold winds. Okay, from the damp and the cold winds, the complaints get aggravated, and amelioration we see is in the open air. Moving further to the extremities. They are affected by inflammatory rheumatism. What is the causation for this inflammatory rheumatism? The abuse of mercury and venereal diseases. The bones, what happens to the bones? The long bones, there will be inflammation and swelling. So we have studied in the guiding symptoms that there will be inflammation and swelling in the joints, in the bones, and the character of pain, severe bursting, tearing type of pain in the periosteum. So far, what are the types of pains we saw? Generally, there will be violent type of pain, violent itching. In the headache, we saw there is tearing and boring pain. Here in the extremities, there is tearing and bursting type of pain. The pain is going from above downwards. The complaints are aggravated at night in the bed from the least touch, motion, damp weather. So we see the modalities again are repeating here. It's a revision for all of us. We will never forget the modalities of Mezereum. That is from the slightest touch, motion and syphilis, right? So at night in the bed, the complaints get aggravated, and in the damp wet weather, the complaints are aggravated. The patient feels better in open air. So what are the new points you have to remember under extremities? That is the rheumatism. What is the cause for the pain in the bones? The abuse of mercury or the venereal diseases which are resulting in effect in the rheumatism. Bones, the long bones are inflamed and swollen. Okay. The general modalities, the complaints are aggravated at night. So you can see here the complaints are aggravated at night from cold and cold washing. And we have from the least touch, you can see from the least touch, motion in damp weather, the complaints are aggravated and the patient feels better in the open air. And also the bad effects of mercury, the complaints get aggravated. So this is all about Mezereum. I hope everything is clear. If you have any doubts, the comment section is open for it. You can put them down. And if you like the video, hit the like button and subscribe. Also, there is some... my voice is not proper. There's some... Bye-bye.